Boy, what a healthy looking crowd. You know, I want you to know I've geared up for this announcement for some time by doing a bike ride in the Delta this last Sunday. Prior to that, I played basketball in Cuba, and then I capped it all off with my annual physical today. So we're trying to lead by example and setting the stage for this, but it's my honor to be joined by a number of distinguished individuals in Arkansas that has led in the healthcare arena. Those that will be speaking following me will be Surgeon General Greg Bledsoe, Michael Knox, Director of the Arkansas Minority Health Commission, Jayme Mayo, Wellness Director at Nabholz Construction, Dr. Pearl Mcelfish, Research Director for UAMS Northwest Campus, and Troy Wells, CEO of Baptist Health. And I'm delighted, there'll be a number of others that will be thanked during this process that have joined us on the podium, but also those in the audience that have been a voice for a more healthy Arkansas. And I wanted to make a couple of points before I turn this over to our Surgeon General. First of all, a healthy, active Arkansas is important to me as governor. This is not a one time we're going to have a news conference on this and forget about it. This is not a public service announcement. This is an objective that I have for my time as governor that is an important objective, that is important to measure outcomes and progress. And it's also important to my number one signature issue in this state, which is to grow our economy and to create jobs and recruit industry to this state. It's an important issue to me because an unhealthy Arkansas is an expensive habit for the taxpayers. Whenever you look at the fact that 40% of healthcare costs on obesity-related illnesses are public dollars that are spent. That's expensive. And then it's not just a taxpayer's dollar to us that it makes a difference in terms of whether we should have a healthy Arkansas or not, but it's also a workforce issue. When you recruit industry into this state, they're looking at their workforce, their ability to show up, to work hard, their absenteeism record, but also are they going to incur health expenses that's going to up the cost of their own private health insurance. So a healthy, active Arkansas makes a difference for recruiting industry to this state and the cost to the private sector. And then it's a quality of life issue. People in Arkansas sometimes have bad habits through tradition or just not understanding what needs to be done or not having the ability to have an annual checkup. We need to, but they want to have a healthy lifestyle. We need to provide the means, the encouragement, the leadership so that they can have the quality of life that they each desire. This issue is important for me as governor. Secondly, the Healthy, Active Arkansas Plan that I have deemed it pulls together leadership in this state from a whole host of arenas. You have leaders in the healthcare industry that are here, education leaders that are present, business leaders that are part of this coalition, and those in government as well. And my objective from a leadership standpoint as governor is that this coalition, that this consortium of leaders will help set the framework for decision making by those in business, those in government, and those individuals in Arkansas that want a healthier lifestyle. And so that as we make decisions in business, we'll look at wellness opportunities and examples of wellness programs in the private sector that might encourage a healthier lifestyle among our workers. Whenever we in government look at Medicaid reform, that we will make healthy outcomes a priority and incentivize those and encourage taking care and responsibility of your own health initiatives for yourself. And education, that we make obviously in education and for our young people, healthy meals, exercise a priority. I'm not one for government mandates. I am for incentives, and I am for providing leadership. We're not going to tell business what to do. We're going to encourage them and lead by example if this makes a difference to the pocketbook and to their own individual business as well as to the taxpayers. And so this is an important initiative, Healthy, Active Arkansas. We want to lead. We want to follow up with the consortium and their leadership. I want to thank Surgeon General Dr. Greg Bledsoe for his leadership on this, and he'll continue to have this as one of his signature initiatives. Dr. Nate Smith and Dr. Joe Bates of the Department of Health have been instrumental and will continue to lead. Dr. Dan Ron, Chancellor at UAMS, has reminded me consistently that we can't have reform in this state without a healthy Arkansas plank being a part of that. Dr. Joe Thompson, Arkansas Center for Health Improvements, have advocated this for many years. Troy Wells, CEO of Baptist Health, has been a part of the consortium and will continue to be. Dr. Marta Lloyd, Executive Director of the Winthrop Rockefeller Institute, has probably done the most in spearheading the framework and the studies that are necessary to mobilize this consortium. So thank you all for your leadership on this. I also want to recognize John Seelig, Director of the Department of Human Services, who I've asked to be here because as we undertake Medicaid reform, this needs to be one of the lead parts of the agenda in terms of healthy outcomes for Arkansas, incentives, and saving taxpayer dollars. And so with that, let me introduce Dr. Greg Bledsoe to explain the nuts and bolts of this.
Well, thanks, Governor, and I just want to say thanks on behalf of those involved in healthcare in the state. We appreciate your leadership in making health and healthy living a main focus of your administration. So it's great to be here, and it's great to begin this new initiative that's both exciting and important for our state. It's exciting because we have pooled resources from both the public and private sector, from academic people, from those who are practicing out in the trenches doing the hard work of healthcare. And it's also important because we have a long way to go before we make our state as healthy as we'd like it to be. As the governor said, a lot of credit for this initiative belongs to the leadership consortium, many of whom are standing behind me, some of whom, like Dr. Joe Bates, wasn't able to be here today. But these individuals represent some of the best and brightest among the healthcare leaders in the state of Arkansas. And they're leaders not only on a state level, but also on a national level. They're tapped for a variety of things around the country, and we really appreciate them being involved in this. The Healthy Active Arkansas Initiative is a project that really focuses on 9 key things, 9 things that we hope will provide a framework going forward to help increase the healthiness in our state. So going through the list very quickly, the first of which is creating physical spaces that allow us to be connected but also encourage us to be active. Initiating nutritional standards for government institutions and the private sector, as well as nutritional standards for our schools. Encouraging physical education and activity in schools, as well as healthy work sites. And we'll be hearing about one work site that was able to initiate some of these measures. Improving access to healthy foods while also diminishing the consumption of sugary beverages, particularly among our young children. And encouraging breastfeeding for new mothers with young children, and in all, pulling all this together, having a marketing plan that is able to culturally, appropriately address these issues in the various diverse communities that we have around our state. For the governor and me, this is a very important issue. We're enthusiastically in support of it, but we don't just want to lead by handing a piece of paper and a framework. We want to actually lead by example. The governor has already mentioned to you that he's a very active basketball player. He even played on an economic trip to Cuba with the Cuban national team, which was very impressive. I'm not a basketball player. I like Brazilian Jiu-Jitsu, which is a martial art kind of like judo and wrestling, and I'm really privileged to have my jiu-jitsu instructor here. He's a former UFC fighter, Rolly Delgado, so he helps keep me accountable, and because he used to fight in the UFC, I do what he says. So we really appreciate everyone who's here today, and the goal of the Healthy Active Arkansas initiative is to pool these resources together and to give a framework for the state. So whether you're in the public sector or the private sector, we have an initiative to engage the citizens of our state and improve health for all of Arkansas. And so to further this theme of getting everyone involved, I'd like to introduce Dr. Michael Knox, who is the director of the Arkansas Center for Minority Health Improvement.
Thank you, Dr. Bledsoe, and also thank you, Governor Hutchinson. I'm pleased to join so many great leaders here today and organizations to announce this Healthy Active Arkansas plan. As an organization, the Arkansas Minority Health Commission focuses on decreasing the health disparities in minority populations through fitness and nutrition, healthy eating, and education. This plan not only reinforces some of our own initiatives and priorities, it also provides the tools and necessary framework for any organization, business, and community in Arkansas to help create a healthier state. Through our programs at the Arkansas Minority Health Commission, we have seen how effective health improvement measures can be when community lends their support to those efforts. For example, we do Camp I Rock, and it's a program that brings 6th through 8th grade girls into a residential program, and we teach them a number of things. We teach them about self-confidence, healthy eating habits, nutritional knowledge, and physical activity. And what's unique about these girls or young ladies is that all of their BMIs is in the 85 percentile and above. And so with bringing them in is a very concentrated effort to really educate them on all these points. And we also follow up with having quarterly meetings with the campers and the parents to actually teach them additional issues. Like for instance, we just recently had a session where we brought the young ladies in and their parents, and we teamed up with the Hunger Relief Alliance. And they actually took these young ladies to a store and showed them how to buy a healthy meal for less than $10. And that's significant when we're talking about some of these Delta areas that income is a critical issue. But also want to talk about just this past September, we partnered with KTV Channel 7 and the Arkansas Rice Depot for a Food for Kids campaign. And that was a backpack program that allows kids to take backpacks home that has nutritious foods and snacks. And we're going to be doing this over the next 9 months. And this program has the potential to provide up to 72,000 meals for kids over this time frame. And it was all possible because concerned individuals got together and decided that we needed to make a change, we need to do something about it. Making a difference isn't just for organizations like ours. As you look through the Healthy Active Arkansas plan, you'll find those 9 areas that Dr. Bledsoe mentioned. And so we're asking you to find an area that fits for you. Look for not only yourself, but your organizations and your communities that can find something that they can do in this, and then take it, own it, and run with it. This plan is a tool for all of Arkansas to use, one that has been carefully considered and thought out. But I'd like to leave you all with this. This is a tool that can make a difference only if each and every one of us pick it up and utilize it. And so with that in mind, it is my pleasure to introduce Jayme Mayo of Nabholz Construction, who can tell you more about the effective health improvement effects that can be done in a corporate setting. Jayme.
Thank you, Mr. Knox. Also, special thanks to you guys, Dr. Bledsoe and the governor, for the support on this initiative. Hey y'all, my name's Jayme Mayo. I'm a physician assistant and wellness director at Nabholz Construction. In 2007, we started a wellness program, and we really did this. The idea was not necessarily to save dollars, but to contain cost. We had to stop the bleed. We moved from a fully funded plan to a self-funded plan. And like most companies, they start with activity-based programs, which means if you do an activity, you get a point. You do so many points, you get an incentive. Well, that's great, and there's some really fun and cool activities out there, but for us, it really didn't make a big difference. And our goal was really to save lives and prevent cardiovascular disease, strokes, and cancers. And so what we did was we moved from a results-based or from a activity-based to a results-based. We looked at our claims, and we saw 5 areas that were really driving our cost. Those were blood pressure, cholesterol, diabetes, tobacco, and obesity. And we tied money to each of those 5 categories. And it made such a big difference to our people, the accountability that they now had. Well, we're a family-based company, and we thought, why are we not doing this for our spouses? So we add our spouses. Now, I have about 800 construction workers, and if you get mama on board, some things are going to start happening. So for us, we really started seeing big changes and big dollars being saved. Over the past 5 years, we've saved over $1 million per year. Our health insurance premiums have leveled off. We've had 0% increases. And this past year, we had a 4.5% decrease in our premiums. Now, what does that tell your people? You know, hey, we're giving you guys money back. That's really made a difference in our turnover. Our retention is very, very low, and also with recruiting. So we've seen some big changes. We're successful for 3 reasons. Most importantly, I have incredible executive support. These guys are sharp, they're proactive. The second reason is I have a very simple plan that meets the needs of my people. And the third reason is that I have a team of incredible, qualified individuals. I'm a physician assistant. We have a physician on staff. I have a bilingual dietitian. I have a personal trainer and a medical assistant. Again, what message does that send to your people? Nabholz cares not only about its employees, but their families. So thank you again for the opportunity to be here today. I would like to turn it over to Dr. Pearl Mcelfish from UAMS.
Thank you, Jayme. It's hard to follow those great examples and that excitement, and thank you, Governor. At UAMS, we're really excited about the Healthy, Active Arkansas plan because it does provide a framework in which we can customize the activities to really meet the needs of special populations. In Northwest Arkansas, we work with 2 of the largest populations are Marshallese and Hispanic, and those are growing populations in Northwest Arkansas, and they have greater rates of obesity and obesity-related diseases such as diabetes and cardiovascular disease. And so working with those populations is often different than we may have with other middle-income groups, but we've begun to partner with faith-based organizations and with poultry industries to design plans that work for that third shift poultry worker, as well as the school children, and as well as those other groups in the communities wherever they are. And so I'm very pleased to see that the plan takes into consideration language and culture and all of the things that affect our behavior. I'm also most excited that it talks about the structural and environmental elements because we can focus a lot on individual behavior and how to help people make individual behavioral changes. But what we know from research is that some of the best changes can come from structures and environments and policies that we have an opportunity to support in our state and in our organization. And so we at UAMS are very excited about the Healthy, Active Arkansas plan and look forward to working with all of you. I would now like to introduce Troy Wells with Baptist Health.
Thank you, Dr. Mcelfish. I appreciate that introduction. It's my privilege today to announce to you that just last week, the Arkansas Hospital Association officially endorsed Healthy Active Arkansas. Hospitals and other healthcare providers have a very unique opportunity to impact the health and well-being of the communities that they serve. And hospitals in Arkansas, we serve every square inch of this great state that we live in, and its members and the association are committed to the elements of this plan. On a personal level, I'm very excited to be a part of this consortium that's doing this work. This is, we're not naive. This is going to be a lot of work. But the people who stand up here today are making a commitment to this plan, and we're going to do everything we can to make this successful. We care about this state, and we're asking each one of you to join us in this challenge that we can achieve. Thank you all for being here today, for being a part of this event, and I think now we have time for maybe just a few questions.
this is going to require additional funding from the state and also specific changes in state law. And how is this something you're going to be seeking next year, the year after? What's the plan?
First of all, I don't think this is going to cost money. It should save money. It should save money in Medicaid cost. It should save money certainly in other health care costs in the state. And so that's the objective, is to save taxpayers' dollars through this. In terms of specifics, the consortium could recommend the next session some laws that would help carry out a Healthy, Active Arkansas initiative. That will be considered, based upon the recommendations. I think the next step, or the one coming up, is the Medicaid Task Force and what they'll be recommending. And of course, my admonition is let's make sure Healthy, Active Arkansas is a part of that consideration. And so I think we'll take it a step at a time in terms of what this means for the future and in terms of further legislative action.
I would just say I 100% agree with the governor's assessment. No, but it's a truism in public health. It's a lot less expensive to put a fence at the top of the hill than an ambulance at the bottom. And a lot of the discussion on health reform over the last few years has been on going upstream and trying to attack the problems before they become major issues, before we have diabetes and obesity and heart disease. So the great thing about this Healthy Active Arkansas initiative is it puts the focus where it needs to be, upstream, to start preventing some of these problems and hopefully saving money in the long run because they don't develop into these chronic health issues that are so expensive.
I guess let's let it play our friend's question. Like in here it talks about incentives for businesses providing healthy options. It talks about encouraging businesses to do these options. Are you looking at things like tax credits or incentives?
We're not looking at tax credits. Again, you look at the example of Nabholz. They did it not because of a tax credit, but they did it because of self-preservation and cost containment. And so, if our consortium sent out information to employers by example as to good outcomes for business and cost containment, businesses will follow. But I'm looking at it as governor from all of the standpoints that I said. Healthy, Active Arkansas brings good results, and the first result I'm interested in is the taxpayers. And just take the teachers' health insurance program. This is, we had to put one-time emergency money to shore up that insurance program, and it's because they had some very unhealthy outcomes. There were a few other structural problems, but that's taxpayers' money. And if we can avoid those kind of emergency circumstances, we save money. So I don't see tax credits here. I see leadership that's here. When we're talking about incentives, that's really more in the Medicaid arena that does impact the private sector. For example, if we do in fact require those above 100% of poverty to contribute 2%, there might be some incentives within that package for healthy, active lifestyles. And so there are things that can look at from an incentive standpoint, but it's leadership by example.
So what's involved in setting new nutrition standards in schools? Will you go to the Board of Education, Department of Education, or does that require legislation?
I'll answer that unless somebody's an expert. Well, there already are nutrition standards for the schools, and so we already have a great deal of requirements in terms of what's offered in the school, and so I don't know that it's a matter of more and heavier mandates. It's a matter of adjusting and making sure we have the right nutrition in our schools. And I think that is both for those that are in need of extra healthy breakfast or healthy food to take home, but it's also about for everybody in the lunchroom. So that's not anything new. That's a government responsibility to make sure that we have good, healthy standards for our schools. All right, was there any other questions?
I just have a comment. I don't know if this is the right arena to bring this up, but we're talking about activities, we have the healthy lifestyle, but we got to have healthy environments too. For the people
Here,
to
here.
get out and exercise, where they feel safe, the kids feel safe to get out and play. Because if you know, some of the neighborhoods that we live in is not safe to get out and run and jump, play, grow a garden, because we got a war zone going in some of our neighborhoods. So I think we also have to create a safe environment to have a healthy lifestyle. And that's just my opinion.
Well, I'm grateful for your leadership. The Stop the Violence effort is important for safe neighborhoods, but it's also, you know,
It's all over.
yeah, violence does not lead to a healthy outcome. I guess I'm trying to say that gently. So thank you for your leadership on it. Your point is very, very well taken.
I guess one thing I'm trying to figure out, you know, when Governor Huckabee was in office, there was a big push for Healthy Arkansas and a lot of initiatives under that, and it was kind of the same themes. I guess how is this any different than what you tried?
I wasn't, I can't comment on the specifics of what Governor Huckabee and his administration proposed or did. All I can say is that we have what is unique in a coalition of state leadership from every sector that wants to lead in this effort. There's a gap. You look back over recent years, I think this has been missing. I think this is a new initiative that is leading with all sectors. But I'll also say that I wanted this to be a positive value set for the state of Arkansas. This is not an anti-obesity phraseology. This is a healthy, active Arkansas. And that's a positive message for this state. This is what we want. This is what we want to strive to. And we don't want someone that is overweight in the school to go away feeling worse because they've been singled out as, you know, not fitting in. Or so that's not the objective of this, is to stigmatize any element of our society. The message is, this is what we want to strive for in Arkansas, a healthy, active Arkansas. It's a positive message. It's being led in the right way, and we expect it to have a good outcome. Thank you all very much.